This case is a successful treatment of low back pain and sciatica. This patient is male, age 77, college professor. 2 years ago, this patient fell backwards onto the hard floor, cement floor, while trying to pull out a market cart. And for some reason, he had his feet on top of the wheels. So when the cart came out, he had no other choice but to fall backwards. He did not have proper footing because of his feet were on the wheels. He heard a pop in his back as he landed. Upon examination, that was MRI, stenosis was discovered in the lumbar region. Stenosis is not easy to treat. For some reason, patients may have disc herniation or degenerative joint disease or spondylolisthesis, different kind of conditions. I've noticed that stenosis is one of those that is not as improving than other conditions are. The patient experienced right buttock sciatica and did not find any comfortable position sleeping at night, whether it's on the side, left side, right side, on back, on stomach. No position was helpful. Therefore, even when he fell asleep, he would wake up every 2 hours. And it has been like that for 2 straight years. The lumbosacral pain was sharp like a needle. The pain was so severe that he couldn't even do physical therapy. He was given tramadol, which is an opiate, and it did not help much, but caused constipation. I gave Bisoma Acupuncture on right-hand side. Those are Yang Horary points, LI1, UB66, gallbladder 41, small intestine 5, stomach 36. Those are metal, water, wood, fire, earth points, respectively. No need for diagnosis because Bisoma has only two choices for treatment of pretty much what acupuncture treats. That's a variety of different kind of conditions. He received acupuncture twice a week in the first couple of weeks, and then he came once a week, but he only came, I believe, total about 6 treatments. But his improvement was dramatic. Even with what I've seen, he was one of the best improving patients. After the first treatment, he experienced a relief that exceeded my expectation. The range of motion improved in all planes, right, left, front and back, rotation to the right, rotation to the left. And the following morning, he was even better. And of course, he slept better that night. He only woke up twice that night. That meant every 3 or 4 hours. After the second treatment, his condition was even better. While waking up in the morning caused some ache. After he got up, moved around a little bit, it would go away. The patient experienced linear improvement. Each visit was additionally better in intensity, frequency, and duration. After second treatment, the patient reported an overall improvement of 70 to 80%. After the third treatment, the patient experienced one evening of bad pain in the middle of the night in the lower back, but there was no sciatica. After the fourth treatment, the condition further improved. After the fifth treatment, the patient experienced normal stiffness in the morning, like a mild ache, and then it will go away after walking and stretching. At the 6th visit, he reported 99% of symptoms being gone. No more sciatica, no more neuropathy, no more local lumbar pain. This patient had an intractable, stubborn pain for 2 years. Epidural did not help, tramadol, opiate did not help. And he also had structural problem, which is stenosis. Stenosis is a narrowing of the vertebrae spinal space within, so that would choke the spinal cord, and you cannot change that. But for some reason, acupuncture had relieved the pain. And I believe, in addition to being the correct acupuncture points for him, some people are so reactive to acupuncture, like him, that each visit would give him not only relief, but seemingly that there was a recovery. We would have to wait longer to see how stable he has been. But my experience is that those people who recover like this, they just stay better. And because he's age 77, that does not mean he's going to prevent all the pains in the future. He'll probably experience them, but he will probably recover quick and fast. And these low back incidences will occur infrequently. And him getting acupuncture on a regular basis every 2 to 4 weeks will allow minimal recurrence. Not only that, acupuncture is comprehensive. It helps him mentally, physiologically, in a comprehensive way. Therefore, his quality of himself, his physiology, is enhanced and stable as he continues to get regular treatments. With this Bisoma Acupuncture, with only LI1, UB66, gallbladder 41, small intestine 5, and stomach 36, he had a significant improvement. And it was clearly what he needed, and in comparison, it was clearly a superior treatment.